Hi, Austin. How are you doing?
Hey, Dr. Huber, I'm great.
Good. You look good.
Yeah, well, it's been 6 months, so yeah, I'm really pleased with
Good.
the results. Yeah.
Good. So yeah, like you said, it's been 6 months since your surgery. So I just like to take this opportunity to check in. Sometimes we check in live like this. Sometimes people just send me emails, but I like that we're checking in on video like this. So it gives us a chance to review how you've been doing, answer some questions, and go from there. So tell me how things been. I can already tell you have more hair than you did before.
Yeah,
So tell me about that.
yeah. I'd say at 4 months things started to really change quite drastically,
Okay.
and it's just been great. My mother-in-law came up to visit just a week ago, and we were having a conversation. We were talking about hair loss, and she kind of made this comment. It's like, well, Austin, you have a nice full head of hair, and I was like, well, that's because I got a hair transplant, and she was surprised. So, um, yeah, she hadn't seen my hair in a little bit because I guess I've been wearing a lot of baseball caps and with COVID. So, yeah, it was nice just to kind of hear it from someone else. So it's been going really well. Yeah.
Good. Believe it or not, I hear those kind of stories a lot where family members just kind of don't know what the difference is, but there's something improved or better.
And they can't
And
put their
that's a good
finger on it.
sign. Nobody knows you've had a hair transplant. Yeah.
Yeah.
Show me, like, use your hands to draw your hair back a little, especially in that frontal hairline, and get a little closer to the camera and show me the
Okay.
progress so far. Yeah. Looks great.
Yeah. So here there was no hair. This is all new hair here, and
Yeah.
some of
Right.
it's
Yeah.
long, and but there are some. I'm not sure if you can see it, but there are some smaller hairs that are maybe just about a centimeter long that are coming in. So it's yeah, it's just
Yeah.
gonna get better.
Well, I would say that you've had either a typical or even a more than typical response to your hair transplant. For some people, the hairs even just start growing at about the 6 month mark. So for you, they've clearly been growing for a couple of months. You'll probably notice that those hairs are still pretty fine at this point. They're still gonna, new hairs may still come in, and the existing hairs that have already come in may even fall out and regrow and continue to mature and thicken. And the overall effect will be that you'll see even more density over the next 6 and even 12 months. So this is a good start, and you're going to continue to see progress over the next 6 to 12 months. And that's even more true for people who are using supplementary therapy. So I want to take this chance to ask you and to remind me, what are the supplementary therapies that you are using at this point?
So I've been using a laser cap once a day, and then I also at nighttime I have minoxidil with finasteride mixture that I apply to my scalp.
Yeah. Perfect. So you're using the BioLite laser cap, and that's a good one. It has like 270 medical grade laser diodes, so that's a good one. And you're also using our high strength minoxidil formula, which is combined with finasteride. And so you're using that once a day. Is that right?
Yep, once a day. Yeah, it's pretty easy.
Yeah. Yeah, so that's the benefit of using a higher strength formula is that we've been able to go up on the dosage, which allows us to go down on the frequency of use. So rather than twice a day, you only need to use it once a day to get the same effect. And those therapies look like they are working well for you. Like you're not losing any more hair. Your growth in this early phase following your hair transplant is maybe a little more robust, and you were telling me a little earlier that you've made this investment in your hair, so you want to optimize it. So you're doing all the right things. At this point, I would encourage you just to keep doing what you're doing. And as you know, as we talked about at the time of your hair transplant, we're going to reevaluate those supplementary therapies in another 6 months, which will mark 1 year after your surgery. So that's great. I'm very happy to see what's been going on. I know we put some graphs in the crown as well. Can you flip around and just
Yeah, sure.
show me the crown as well? Yeah, just lift your head up a little higher. Yeah, oh, that's good. That's good right there. I can see what I got to see. That's perfect. So same with the front. There's definitely an improvement over the crown there. I think you're going to continue to see more of an improvement over the next 6 to 12 months, especially with those supplementary therapies. So, I'm very happy with what I see at this point. I think you've told me previously that you're pretty happy with your progress to date. Your mother-in-law is
Yeah,
happy with your
yeah.
progress to date.
So,
So that's great. Keep on doing what you're
okay,
doing, and I expect things to be even better in another 6 months.
okay, that sounds great. I was wondering, just because it's summer, should I be wearing a cap just to protect the scalp?
So you don't need to protect your grafts are and your follicles are not going to be
Okay,
damaged at this point. So you don't need to wear a hat to protect your investment, so to speak, to protect your hair transplant. But just continue to take normal sun precautions. So when you're in strong sun, obviously you want to be wearing a hat to protect the skin underneath your scalp, or you want to be using some other sunscreen on there, like a spray sunscreen. That's totally fine to do, and that's all you need to do at this point.
okay.
So, Austin, do you have any other questions before I let
No,
you
that's
go?
it. I'm really happy with my hair, and I look forward to the next 6 months.
Yeah, good. I'm happy as well. And as we've talked about, our next kind of visit like this will be in another 6 months, which will be about 12 months after your surgery. And we'll review your progress again, and we'll also review some of the supplementary therapies that you're using at that time too.
Okay, great. Sounds great. Thanks, Dr. Huber.
My pleasure. Nice to see you as always. Take
Bye.
care.